So I'm sure you have lots of questions. Again, if you would like to use one of the pads on your table, or if you have a card left, fill out the cards, hold them in the air. We'll whip around and grab them quickly. We'll get Serene and Nissan up on the panel there in the stools. And this part of our panel is going to be moderated by Russ Klein. So I'm going to get Russ to come on up, and he's already got some questions for you.
Actually, I have two questions here, but I'm going to ask one on my own first, and that's, for the two of you. You probably said it in your presentation, but because we've talked about students' one of the most uncomfortable side effects is diarrhea. What do you recommend? I mean, I think you probably said it already, but it's always worth reinforcing. Kind of, what is the?
Well, diarrhea with Suitant, it depends on how much you have, but usually, oftentimes what we do is we talk about diet, natural sort of bulking agents that can help. When I was talking about Metamucil, and having that with a very small amount of water so that the gut can absorb, the supplement can absorb the fluid in the gut. As well, I think we do also prescribe Imodium, and that's an over-the-counter, and usually what we end up doing is asking patients to take 2 Imodiums at the first diarrhea and then 1 subsequently after that, and that usually does help. And then if that doesn't help the patient, then there's also stronger medications like cholestyramine and Lomotil.
Okay, perfect. I mean, I think this is really good just to reinforce. Dr. Scholey, a couple of questions here. Someone wants to know, what is the average EGFR in someone who has only 1 kidney?
This is on. Yeah. No, it's an excellent question. So one of the remarkable things that a kidney can do is respond. So if I have a young person, 40 years of age, with 2 kidneys, and each of those kidneys has about 50 mils per minute of function, their GFR. When we do a nephrectomy in that individual, there's a good chance that the GFR in that remaining kidney will rise to about 70 to 80 mils a minute. And that process is called compensatory hypertrophy. The kidney gets bigger. And compensatory hyperfiltration. That kidney begins to hyperfilter. So it compensates. And that's a critical function, and it tends to preserve kidney function. Now, in a young person at age 40, I would predict that their creatinine clearance would rise by that amount if they were healthy, and that would probably mean that their serum creatinine might not even rise out of the normal range. Now, there are important determinants of that compensation. The first, of course, is one you probably guess, age. As we get older, the ability of our kidneys to compensate becomes progressively impaired, likely because our blood vessel health declines. So that if a young child, God forbid, in a motor vehicle accident, for example, has trauma, loses a kidney, sometimes that remaining kidney can grow and even double in size. An individual 70 years of age with a history of hypertension might see relatively little compensation, and their creatinine clearance might fall by half if they remove a kidney. It's difficult to predict, so we look at things: age, comorbidity, that is cardiovascular disease and high blood pressure, as predictors of that response. And last but a little bit less predictable is gender. Turns out that male kidneys compensate a little bit more than female kidneys, particularly in rats, but a little bit more less predictable in humans. So I generally tell people that when they're about to undergo a nephrectomy, that's what I'll see them. I say, we know what your baseline kidney function is. We know what the worst case scenario is, no compensation. And we can gauge somewhere in between.
Okay, thank you. Yeah, actually, I know everybody's different, but I know after my surgery, my kidney function was better than before surgery after losing part of a kidney. So odd stuff. I have 2 people asking the same 2 questions. So one of them is there any concern to the kidney for the dyes that are used with the CT scan?
So and that's an excellent question, and the answer is yes, although uncommon. So the number of so one of the concerns is that the contrast material given to kidneys can cause acute kidney injury, And that acute kidney injury, the most important predictor of that is baseline kidney function. And other things, but most importantly, your diabetic status. So what we usually tend to do in that case is if the creatinine is outside of the normal range, then usually we will see those individuals and give them a little bit of salt and water intravenously, and that our colleagues in the imaging departments will use the minimum amount of contrast material to image. And that combination, by and large, leads to good outcomes. Most of us in our nephrology practice have never seen somebody who ends up on dialysis because of contrast alone. But they can have acute declines in kidney function. It is reversible, but we try to avoid it in the first place.
Okay. Let me ask you one more question, then I'm going to go back to Serene. But you make a good point in terms of diet and what people should be eating. I guess there's two questions here. They're interrelated. One person asking, is there a danger being a vegetarian to the kidney? And what should they be replacing in a vegetarian diet, like the meat proteins they would normally have? Or basically, what should people eat and what should they avoid?
Now, when people ask me what they should eat, I turn to my dietitian on our healthcare team and I ask her to give the specifics. So the first thing is that a diet rich in fruit and vegetables is heart healthy and excellent for blood pressure. Mm-hmm. Excellent for blood pressure means excellent for kidney function. Now, protein can be an issue sometimes in patients who are particularly strict with vegetarian diet, although often they'll use soy protein. And that actually is good for kidney health. And protein restriction may be actually beneficial in some particular patients for kidney health. So generally I say vegetarian diet, no. Now, there may be some particular examples with fruit and vegetables where, for example, there's a large amount of potassium. Mm-hmm. And that's where I would turn to my dietitian colleague. And that would typically be for individuals who have low kidney function, less than 20, an estimated GFR of less than 25% of normal. So I would, in concert with my dietitian, but no, the answer is no.
Okay. I'm going to come back to you with one more question, but first, Serene, I don't have a person's question here, but I guess what would be your parting advice? If you've got like a minute and a quarter to kind of tell people the pearl of wisdom.
It would be, if you're on oral therapies, communicate with your healthcare professionals. If you're experiencing side effects, we need to know about it. We can definitely usually stop it before it gets severe, which in turn would keep you on therapy much longer, and then keep the disease under control for much longer.
Okay, you still have about 30 seconds if you want. Okay.
No, that's pretty much it, really. It's and use the advice we give you. Keep the log. The log, I think, is the most important thing that you can bring to clinic and discuss with your nurse. You can't remember everything that happens between one visit to another. So keep it all in writing, bring it, and we can discuss every single issue you may have.
Well, as Joe Friday would say on Dragnet, only the facts. And if you can't come with the facts, it's hard to give any advice. Yeah. Actually, one other one, we just got this from the webcast. My mouth gets sensitive from the effervescence of soft drinks and toothpaste. Is there a toothpaste that doesn't bubble up?
There is. We recommend the baby toothpaste. Those are, and not the mint flavor. So we notice that mint flavor usually, and the harsher, not to offend Colgate or Crest, but those ones are usually very harsh on mucositis. So we say stick with the baby toothpaste, as well as the other flavors. I think I was just told strawberry instead of mint helps, so things like that.
Okay, great.
And with regards to soft drinks, I mean, they're already carbonated. They're already going to sort of tingle in your mouth. So avoid them, or if you really like the taste of the soft drink, wait until it gets flat so that you're able to take it.
Okay. And the last question, Dr. Scholey, it's kind of a follow-up on the last what we talked about before, but what are your thoughts on mucin to protect kidneys from dye?
So that's controversial. So mucomist is actually N-acetyl cysteine. You might think of it more as an antioxidant. You know how we read about antioxidants as being healthy, and so there is some evidence that N-acetylcysteine as an antioxidant prevents some of the injury related to contrast. In the protocols that I will give to imaging physicians, I include N-acetylcysteine. There's some controversy, but it's so benign that I don't think it can do any harm. So I usually do. Typically will use a dose like 600 milligrams twice a day, the day before the procedure and the day after the procedure. I think some people are moving away from that, but it's very benign treatment.
Okay, thank you. As an academic, I can't help but say you passed your comps.
Thank you, Ross.